Good morning. As Ilse said, I'm Ann Leslee Swan. I'm the VP of Specialty Products, Pipeline, and Customer Value for Roche. It's quite a mouthful. It is my absolute honor to be here this morning. We have a history with MaRS, and we are excited to maintain this ongoing relationship and partnership. I know last year you talked about precision medicine, which is near and dear to our heart. And this year, as we embark on patient centricity and a patient empowerment approach today, we are really thrilled to be here. Roche's purpose statement is doing now what patients need next. And it feels like we're in the bit of a revolution, perhaps, or at least an evolution in terms of patient engagement and how we can work to help you and support you in your role forward with bringing patients to the center of their healthcare decision making. It is my pleasure this morning to introduce Leslee Thompson. Leslee Thompson is the CEO at Kingston General, President and CEO of Kingston General Hospital, a position that she has held since 2009. Prior to her role at Kingston General Hospital, she was also serving on many senior leadership positions with the Alberta Health Authority, University Health Network, and Cancer Care Ontario. She has been a chair for the Canadian Foundation of Hospital Improvement and also the university academics. Not only is Leslee known throughout the world for her work on patient centricity and a patient-empowered environment at Kingston General Hospital. In 2013, she was also selected as one of Canada's top 100 most influential women. It is my absolute pleasure to introduce you, and I very much look forward to your talk this morning, Leslee.
Thank you very much. It is my absolute pleasure to be here and help kick off an incredible session today with the folks that you're going to hear from are simply the best among the thought leaders and, more importantly, the doers of people that are truly changing the world. And to start us thinking, I want to just reflect a little bit on the challenges that we are all facing. Right now, if you are an entrepreneur, you are a business person, you are an investor, you're a hospital CEO, or a patient, the future can look, or today also can look a little daunting. But the exciting part is that there are cracks in the walls that have been built up over so many years, where a lot of us thought that change would never be possible, and we're starting to see the glimpse of that change now. And healthcare was built and continues to have so many reinforcements of tradition, of provider-centric, and very dogmatic in our own way of thinking about doing for patients, doing to patients, and now we're starting to hear a voice that we can't ignore. And that is the voice of the patient. And you'd think after all this time, we'd actually understand that we're in the patient care business. But it's incredible when you actually look and unpack the way we do things, the way we plan activities, the way we design our systems, the way we work each and every day, and the decisions that we make that have huge impact on the lives of individuals that we have simply put aside and say, trust us, we've got it all in hand. But if you look closely, as many of you know and experience the system today, we don't have everything in hand. And in fact, part of the reason why we've been missing the boat is because we think that we've got all the answers. And now what's happening is that we are starting in a very meaningful way, a little bit behind the 8 ball, but we are starting to listen and learn from and with patients. And actually, that is creating a force that is really quite unprecedented. We are still in early days of change when it comes to the patient empowerment, the patient-centeredness, and partnering with patients to actually improve care, to improve organizations, and to design health systems that are truly focused on the needs of the patients and families that we are here to work with and to help move forward to achieve their full life potentials on their terms, with their goals. And those are the things, the new metrics are around how well we can actually work in partnership to do things on other people's terms. So we have a role as healthcare professionals, as providers, as innovators, to really help move the bar along. And it feels a little bit uncomfortable, actually, in the early days of change, because we haven't been hardwired to partner. We've got a lot of things on the surface going on, but to truly bring in and embrace a partnership, it's a new day. And when you step out and start to lead and embrace the way of changing how you do business, I can tell you from firsthand experience that it is uncomfortable. And you've got an idea and you know where you want to go and you're listening, and yet why doesn't the thing that makes so much sense and everyone says, aha, of course I get it, why is it so difficult? At my organization, Kingston General Hospital, we are about one example of a number of organizations that are really moving forward of saying, you know, we have to listen and learn in whole new ways. And we're going to do that by affecting the most important feature of our system and the way in which we deliver care, and that's the culture of our organizations. What defines culture? It's actually what happens when nobody is looking. And organizational culture, what we decided to do was to actually 6 years ago put a stake in the ground and said, because of the many challenges that we were having, any decision in our organization where there is a material impact on the experience of patients, a patient will be at the table. I want you to think about your company, your organization, and imagine what would be different if you made that same declaration. Right from the design of your products, who you're talking to when it comes to an investment, everything you do, I want you to think today as you are listening and learning from the incredible speakers that we have here today about what would be different if you made every decision where there's a material impact on the experience of patients, a patient would be at the table. Not at the end where you're pitching to, but actually part of the design process of moving with. This takes courage. And there's a lot of forces that are against actually making this happen because it's uncomfortable for those of us who have been brought up in a time where expertise is all based on what you know. And in fact, how that knowledge relates to and often is designed to keep other people apart so that we're the experts. And that's what it feels like. It feels good when you know things and people need to come to you for knowledge and expertise. Well, I'm here to tell you that the new lived experience experts are patients. And when you actually think about redefining everything about knowledge and expertise and what it means to be an expert, the whole world starts to turn upside down. And in fact, one of the front page Globe and Mail articles that was written about some of the work we're doing at Kingston General Hospital, where we now have 60 patient experience advisors. They're on every committee and council and decision-making body within our organization, and part of the fabric, really, of who we are. They're also on the hiring committees of staff. Because we kind of said, what's the most important feature of the relationship with patients? And that is who the providers and the staff that they're interacting with every day. And so they are now sitting at the interview tables, and they have as much a vote of credence and credibility and veto as the head of human resources. There is no power differential around that table. This power shift is happening not just in individual pockets of right now, but it is happening right across the world. I've been involved lately of being I was in the US yesterday, and in Denmark, there are incredible moves for the patient and family-centered systems that now at the policy level, governments are embracing and saying, we want to be patient and family-centered care. So we're going to use that as a criteria now to evaluate every new initiative. That might be their decisions to invest in new technologies and innovations, and asking the question up front, were patients and families involved in the design of the technology, in the introduction of that new initiative into the space that it is designed to affect? And so all of that is now being shaped at a policy level where governments are truly trying to figure out how do we move forward in this in a very deliberate way. In Brussels, and there in Belgium, there is a whole group called the Flemish Patient Platform. And those groups they're bringing together every patient advocacy group across the country. And they are actually coming together and working. And when government calls and other people want to know kind of what do patients think, this is a group that has self-organized, not political, not tied to any company or other group, maintaining their independence. And they are the go-to thought leaders for everything, an incredibly powerful force of change. I love the hashtag that I've just discovered of "We will not wait." And guess who is driving that? It is a group of patients who are saying, enough. We're not going to wait for you in healthcare to take another 10 years to come up with how we're going to work together from a process perspective. They would have a lot of the DNA that you would have as entrepreneurs and investors of wanting to see things happen tomorrow. They are saying, we will not wait. So there is a readiness, there is an appetite, there is a growing voice of change that you are going to hear many more examples today of folks that are part of the speakers from Melinda and Lucian and Dave and Mike. And these are folks that have agility. They are adapting. They're helping us become a lot more agile and being able to respond and work and learn. They have imagination beyond anything that I've ever seen. And most importantly, they've got a passion for helping to make this happen with us. But if we rest on what we think are our laurels and where we think we are so smart, we actually are going to be bypassed. And we've got lots and lots of examples of industries being disrupted today where the traditional folks, the traditional power brokers, the traditional players are completely being bypassed with the power of the consumer going forward and changing the nature of the game. So these folks aren't in here to just to tell you a little bit about how the game, how to win at a game that's already being played. These are folks that are actually changing the game. And today I'm so delighted to be part of this panel and with you as this particular audience, because we're going to really challenge you to be thinking about your future, your businesses, and your innovations in a way that might be a little bit different than you've thought before. And my ask of you as we go forward is to really listen and think about how to incorporate some of these pretty wild ideas into some of the things that you're doing. And we're going to have a great conversation today. So thank you so much for being here, and let's get started.